Okay, we are now live with today's Courage session, and we are very excited that we have a panel joining us today. Before we get to them, we do want to introduce ourselves here at the Texas Health Education Service. I am Enrique Hasso. I'm the Associate Director of the Texas Health Education Service and the host of the Inside Health Education podcast. Joining me today is Deb Beck.
Hi, I'm Deborah Beck. I'm the advising coordinator for the Texas Health Education Service, and I was formerly at the University of North Texas for about 18 years as the director of the Health Professions Office there.
And we're really excited to have not just one, but two dental admissions deans joining us today. First off, we have Dr. Barbara Miller. Dr. Miller, would you mind introducing yourself?
Yeah, sure. Thank you, Enrique. I'm Dr. Barbara Miller. I'm the Assistant Dean of Recruitment and Admissions at Texas A&M College of Dentistry in Dallas. And I am a dentist. I was in private practice before returning to the college to do some teaching, and I taught preclinical and clinical dentistry for about 21 years. And then the last several years, I've been doing admissions and recruitment and teaching in our ethics and cultural competency curriculums.
Thank you. And also joining us today is Dr. Kay Malone. Dr. Malone?
Good afternoon. Hi, I'm Dr. Kay Malone at UTHSCA San Antonio School of Dentistry. And I went to UT Austin. I'm a Longhorn, and spent 25 years in the military. While I was there, I had the good fortune to do an AEGD 2-year program and was director of both 1- and 2-year programs. And before I retired, I was the chief of graduate dental education, overseeing all residency programs in the Army. So I currently work in the admission office, as well as working with the students in operative and in dental anatomy.
Excellent. So we have some really great folks joining us today, and thank you both so much for taking the time to answer some of the questions that we have from our students. For those of you joining us, we are taking questions live. So anytime that you have a question, please feel free to share it in our discussion box here. We do have some preset questions that we'd like to ask Dr. Malone and Dr. Miller, but we are here first and foremost to answer your questions. This is the admission cycle is definitely on the fritz this year. So we wanted to have them join us to discuss some of the impacts that have happened for dental applicants for this application cycle, as well as address maybe some larger questions about what the dental profession has been facing, particularly now. But if you are a current applicant and you have some questions about the application that you'd like to direct to our dental admissions deans here, this is the time. We will be here until 2 o'clock to answer any and all of your questions. So first off, we have had a few discussions previously on the Courage sessions around the delays of test scores that have come out during COVID-19. We have some test dates that have been delayed during a TMDSAS advisory committee meeting. We actually found out that the applicants that would typically take the DAT for any application cycle, typically most of them will take it in the first few months of the year, which are the ones that have been the most affected by COVID-19. So would you mind walking us through what the scenario looks like, or what the landscape looks like for those that have had a delay in a DAT assessment?
So you want to go first, Dr. Malone?
Sure. All the dental schools are in the state of Texas are together on this, and at this currently, we do still want the DAT scores, although we're not going to be starting the interview process till at least a month later to give individuals time to input the DAT scores. Also, I think there was a meeting last week with the testing service, and they've assured all the dental schools that they're going to open up more testing sites, or at least make it more available in terms of spreading out the availability for students, because we know that there's issues in terms of distance between those taking the test and so forth. But the testing service is accommodating for this. And so we know it's going to be later on in the cycle, but we understand that. And we're just going to delay our interview process until later on and finish later on in the cycle.
Mm-hmm. Yeah. And just to add a little bit to what Dr. Malone was talking about, we have been meeting. All of the Texas dental admissions people have been meeting, and I think we did agree that we would start reviewing the applications as soon as we receive them, even though they would not necessarily have their scores yet. So we'll start that. We probably won't start to send out invitations for interviews until we see the DAT scores. So that's kind of where it is standing right now, but we will start reviewing the applications.
Typical Zoom issue. I start talking and it's still muted. Thank you both so much for that insight. Obviously, quite a few students have been impacted by the delays of the test scores. And so hopefully everybody is able to feel a little bit less anxious about the process, knowing that submitting your TMDSAS application without a test score is still an option for you. And just so you all know, TMDSAS has not transmitted any applications to the schools as we typically do, and will not do so until June 1st. And so June 1st is the first batch of applications that the schools will be getting. And so applying early, which is a message that we've really driven home in previous years, is going to look a little bit different. And we did discuss some changes to the application timeline a few weeks ago when we had Matthew Meeks, the executive director of the Texas Health Education Service, and TMDSAS join us. So would either of you have any insights into what applying early means now for a dental applicant for this cycle?
Who goes first?
Well, applying early is a little bit later than it usually is. So yeah, we usually say, have your DAT done by the end of August before your fall classes start. And for a lot of people, that's just not going to be an option. And so it is important to go ahead and sign up and try to get a spot to take the DAT. And let's see, so like Dr. Malone said, we'll probably be interviewing much later into the year. Usually we stop maybe mid-January with interviews, and we're probably going to all interview into February. And so, yeah, so there's time to get the DAT done and get the scores to us as soon as you can. Mm-hmm.
We need to make a t-shirt that says there's time, don't fret. Well, thank you for that. We have our first question from one of our viewers right now. It's Luis Sanchez. Thank you for posting a question. So the question is, I filled out COMAS and AMCAS for a couple of Texas schools only. If I put in my TMD, this is a medical schools question. I'll get to these at the end for medical school questions. Right now, we want to take full advantage of having our dental deans here who are going to talk about the dental school application. But we will sprinkle in a few of the medical questions that you all have. We know that they are, y'all's concerns are just as valid, and so we want to make sure that we're addressing those. After all, during the courage sessions, we want to encourage you to continue with the cycle. But for another question for our dental deans, for the applicants who have had plans to shadow a dentist over the summer, but obviously can't do so now, are there any changes for the requirement for a letter from a dentist, a practicing dentist?
Yeah, I'll take this one. I thought about this, and but if it's a person who's going to apply this summer for dental school, probably before the pandemic, you had a chance to get to know a dentist because, it's just like been since the 1st of March. So usually the people that get interviews have been interested in dentistry longer than just a couple of months. So, I don't think we have any plans of, some of the dental schools don't even require a dentist letter, but we usually do. And I think we're going to still want to see that. If you only had a chance to get to know a dentist briefly, and maybe you didn't get a chance to shadow them as much as you want to, I'm sure, they would let you call them up and ask questions. Maybe they wouldn't mind mentoring you virtually through like FaceTime or something like that. And you can still get to know a dentist and ask them questions and about their practice, about their business. And another good thing is like to ask the dentist now, how has the coronavirus changed their practice? Because that's something that all the dentists are dealing with now. So even more reason to stay in touch with your dentist mentors. And I think in that way, you could still get a letter from them. So I don't know, maybe Dr. Malone has another idea on that, but.
Well, for San Antonio, we're one of the schools that doesn't technically require a letter from a dentist, but normally we'll see it in the packet anyway because the other schools want it. So we still look at it, but we don't specifically require it. But I agree with Dr. Miller. I think a lot of changes have occurred with the coronavirus in dental practices, and that's a great way to talk with a dentist and ask them, how does it affect your office? And it's something for you to think about in the future as a dentist. And hopefully we'll never have this kind of issue again, but you never know. So it's just another avenue in which you can communicate with the dentist and just get some further information.
That's some great feedback. And I do want to follow up on the idea of being mentored by a dentist online or through some sort of digital platform. Would you mind sharing your experiences with that?
Well, this is a new thing. I don't have any experience with it. Maybe Dr. Malone does, being in the military. I don't know. Maybe that's a little different.
Well, I think any time where you can communicate with a dentist, that'd be great. I think here you're sort of limited because you can't physically do it. But I think within the application itself, I think we're still going to look at either within your essays or other places in which it shows that you still have the interest, even though you cannot physically go to an office, you're still trying to communicate, even if it's virtually with another dentist, and just try to mentor through that avenue. And so we still look at that because it's your desire and your motivation to be a dentist. So anything that you can add to your application, given the current situation, would be great.
Mm-hmm. Oh, and I have something to add too. Even before the pandemic, pre-dental students would tell me about all of the YouTube videos that they would watch about dentistry. And so there are just a lot of those that are available. So you can find out about all the different specialties and different procedures. And, I think that might be another kind of digital way to shadow.
Mm-hmm. Yeah, this situation really opens the doors to think outside the box. And I think it's incumbent on the students to really have that initiative to seek opportunities. We hear this all the time on the news, but it's a new normal. So it's asking the questions of how you adjust to this while staying on track with what your ultimate goals are, becoming a dentist. Mm-hmm. Dr. Beck, did you have any insights on some of the students that you've spoken to with regards to how their activities have been changing? Maybe if you have any examples for dental applicants as well.
Right. I think there is concern about that because they can't get out as readily. So there have been some questions about what type of activities they could get involved with. But Enrique, let me go back and pose a question about the letter, if you don't mind first. Maybe you could shed some insight on why that letter from a dentist is so important.
Yes. Well, I think the history at my particular college is they have always required a letter from a dentist. And I think that was to kind of follow up on the shadowing and kind of like the relationship between the applying student and the dentist. And it was to encourage the applicant to have a mentor who's a dentist that they could talk to and be encouraged by. And so what we would look for in those letters was like the amount of engagement of the pre-dental student when they were shadowing. So of course that part, is impossible right now. That's what I was hoping, that maybe they had done some shadowing prior to March, and so a letter, not just from any dentist, but, someone that they had a chance prior to the pandemic to go into their office and shadow them, because it's interesting to hear about the questions that the applicant is asking the dentist, and like their interest in kind of learning more about dentistry before they actually, get to dental school. And also the way that applicant interacts with the staff there in the office and the patients. And so, it's kind of people interaction that is just so hard to do right now. And we all understand that. And we realize, I can't imagine how any of the applicants are going to have any hours over this time. It will all be the things that they did prior to this. And so the people that are like in the pipeline, they're not going to be applying this summer. As soon as it's safe and the dentist will feel comfortable letting more people back in their office. Who knows when that is? Yeah. But that's going to be an important thing to, get back in the office and interact with the people. In the meantime, there's like, I think there are still opportunities to do volunteer work in the community. There seems to be so much more need now in our communities, or the need that was there is being exposed more now. And as long as it's something safe, because I wouldn't want anybody to put themselves at risk. But there are ways to interact with the community still.
The food banks and are shopping for someone in the community who can't go to the grocery store. Things like that.
Yeah, like giving your time for other people. The other thing that I've been thinking about is there's so many families that their young children are home. And I know a lot of college students in the past have volunteered, like going to an elementary school. Well, that might not be possible, but I'm sure the teachers and the parents would love to have college students helping during this time and kind of taking a little bit of the burden off of them. And I'm sure the young students would like that too, to have a college student mentor. And so, maybe there's some things like that. I can imagine people like contacting their old elementary school or their old junior high and finding out, like, maybe there's ways to volunteer virtually to help the community that way too. So like with young people, interacting with them, maybe elderly people too. Of course, a lot of this has to be virtual now, but that's so much of our life has moved to the computer screen and these little boxes. So it's something else to get comfortable with. And that few second delay, whatever it is.
Well, maybe somebody could even start a volunteer DAT study group.
Oh, yeah. Help each other.
Sure.
Yeah, for sure. Yeah. Yeah.
I do want to chime in just logistically for those that are filling out the application right now. You may have an activity that was delayed or postponed, but you do have both current and planned activities that you can enter in your application. So let's say you had a summer internship with a dentist office over the summer, and this happened and they might not be able to take interns, but perhaps would revisit that in the fall. After the application closes, you are welcome to include that as a planned activity, and that informs the admissions committees that even though this activity was delayed or canceled, that you have additional planned activities that will be coming up. And so that shows that you're not just taking the cancellation and just trying to move forward, but rather that you're being proactive with what you're doing. So use that planned activities section strategically as well in the application to use it as a way to inform the admissions committees of what your plans are.
Yeah, that's great. We really like that planned activity section. Yeah, that's really great. Yeah, and the other thing they could do is like front load courses. Just don't be idle. If you want to, go ahead and keep taking online courses like through the summer, and then when your schedule opens up, that will kind of open up your schedule. So when things are able to be back in person with activities, then you'll have more time then. Go ahead and take physics or whatever it is that you've been putting off, and then that'll open up your schedule later so that you can do those activities.
Yeah. It's almost as if that students are putting off physics.
Not all of them, but some do.
Right. I think. Physics it's commonly targeted. So again, we are here answering your questions. We have two dental admissions deans, Dr. Kay Malone from UT Health San Antonio School of Dentistry, and Dr. Barbara Miller from the Texas A&M University College of Dentistry. So if you have any questions, feel free to join us in the chat, submit your questions. We do have a list of questions that have come in, and we'll be going off of those as well. On the theme of our letters of evaluation for dental schools, we do have some follow-up questions that Dr. Beck collected, one of which is it okay to get letters from a work supervisor and or volunteer supervisor along with a letter from a dentist rather than from professors?
If you have no other option, then you would have to go with that, but we prefer letters from a professor because they can evaluate you both personally and academically. So like, for instance, a dentist will know you personally, but they have no clue about you academically. And so that's why for us, we like to see what have you done academically? How do you relate to the other classmates? How well did you do in that class, and so forth? And so a work supervisor will know you as a good person, a good team player, and so forth, works really well with others, but they may not know about you academically. So that may be a fall down from a letter from a professor. So it's just more of a preference for us to have one from a professor because we get more information from those particular letters.
Yeah, and I would agree with Dr. Malone. And my admissions committee, they would really wonder about that, about not having a professor. Even the people that are applying this summer, that you've been in college for 2.5 years, And so even those courses that you took pre-pandemic, you know, think about asking those professors to write a letter for you, because especially the science professors, that's what my committee really likes to see. Yeah, that's important. You know, we have received letters from work supervisors and volunteer activity kind of supervisors. And those are just extra. You know, we read those. Sometimes they send them directly to our office rather than going through TMDSAS, and we do add them to the file. It's just they're not as not so much what we're looking for as the professors, the science professors. Yeah.
So I have two follow-up questions to that. First one, I want to punt over to Dr. Beck. In your work with advising students, what advice would you give kind of in the preparation to the application? What advice do you offer for somebody who, you know, has that professor from a few years ago and wants to get them to write a letter, but they never set the groundwork to get them to write a letter?
Yeah, that's tough. If you, and I understand that many of the class sizes are very large. Hopefully you have gone to their office hours earlier, and some of the professors aren't too good about answering emails, but hopefully now that this is the only means of communication, they are reading their emails and checking them, and also have that sense of duty to the profession, because we need dentists and good healthcare workers. So hopefully you have established that relationship in some manner with the professor. Maybe you did some research in his or her lab. It could be that you didn't have direct contact with that person a lot. But if they're able to see how you operate even in a laboratory situation, that you're there on time, that you are responsible, that you read the literature and try to, you know, you catch up on the professor's research, or just it can be difficult right now, actually. So don't give up on them. If you have to, send them a paper letter and write them a letter and tell them how important that letter is to you and to the process of the assessment of your abilities to become a good dentist.
I guess the secret is to be early in the game. And what I do is I tell a lot of students, even in the first or second year, I say, you know what, if you have a professor that you're going to have for several courses, you make an appointment with that professor, and it takes guts. You know, you make an appointment with that professor and say, you know what, I plan to apply for dental school 3 years from now. What will it take to enable you to write me an outstanding recommendation? And they're going to give you several suggestions. And you say, okay, I'm going to attempt to do that. And if you don't mind, I'd like to see you make an appointment every 3 or 4 months, let you know what's going on with my life, and just update that professor as to what's going on. So that will enable that professor to come back, and the very first couple of sentences, this individual came to me 3 years ago with asking me what it would take to write a recommendation. We don't even look at the rest of it because we know it's already going to be a great recommendation. Because that shows initiative, that you're prepared, that you were thinking, you know, far out to get that goal. And so when you start very late, then it makes it more difficult. So it's just really tough. So I always suggest to start early, get connections with a professor early, build that relationship, and that way they can write it very easily and very quickly, write a recommendation and not struggle trying to write you a recommendation that we can tell that the individual struggled to write that recommendation.
Right.
Yeah.
one thing I might add to make it a little easier for the professor is for the student to include their resume when they write them an email. They can also include their personal essay on why they want to be a dentist. And that may give the professor some insight that they might not have had previously in just talking about coursework or things like that. In the past, pardon me, I have required a questionnaire. And, if the professors want to make up a questionnaire about things that are important for them to include in a letter, I would encourage them to do that. And then if they want to also interview them one-on-one via Zoom or over the phone, they can, the applicant can ask them to if they want to do that. And they may recognize their face. Maybe they don't remember their names or something in big classes. So there's still ways to do it, to get that letter.
Yeah. I think you hit a really strong point there. Actually, all of you have kind of hit on the point that the letter should provide an overarching message to support your application. And this is probably the easiest way to do that is to get the support of your health professions advisor through an HPAC, a health professions advising committee letter, where they will actually help you. You put in quite a bit of work on your end, but there's an interview process and they collect letters, and many times they will actually write a letter collectively as a council and then submit those to the schools. For those of you that have to submit letters individually, that falls on you. And so it's important for you to kind of figure out the message that you want the admissions committees to take away from your application and what you want them to really focus on in your application. Something that we really drive home for our medical applicants is to really learn the core competencies that the schools have defined. And anybody that listens to the podcast knows that I refer to them almost every episode because they're essentially the language under which a school will evaluate their applications. Do the dental schools have similar core competencies or maybe values or mission statements that applicants should be looking at to incorporate?
So, I think we all have mission statements, every institution, but are you talking about something specific for medical admissions? Because I've never heard that.
So they are actually an initiative that the AAMC put together. Following a survey and a focus group committee of several of the schools, they developed a list of all of the competencies that somebody who will be successful in the medical profession should possess. And then they reverse engineered those to remove all of the intervention points in professional school and medical school. And they figured out what the core list of those would look like for a medical applicant. And so it's a list of 16 competencies covering, accountability, resilience, science competencies in living organisms. And so based off of those, they really offer applicants kind of an insight under, it's essentially a rubric under which the schools are evaluating their applications. And perhaps since that similar initiative hasn't taken place for the dental schools yet, perhaps you might walk us through some of the specific things that might stand out to you in a positive way in an application review.
Yeah. Do you want me to start, Dr. Malone?
Sure.
Okay. Well, what we do is the first screening is for their academics. And so what courses have they taken? Have they challenged themselves with the more challenging courses that a dentist needs to take? And how well they did, so the GPA, and then how well they do on the big test, the DAT. And so the academics, that's like the first level. Then I think all of the dental colleges are doing like a whole file review. So then that takes into account like what they've learned about the profession. So like we were talking about shadowing and like, looking up on the internet, YouTube videos, all the different ways to learn about dentistry. So their knowledge of the profession, and then also their communication skills and empathy and the kind of things that you would develop those skills, or like doing your volunteer work with people of different age groups, different backgrounds. So that's part of it too. Leadership skills. Like while they're in college, they should run for office in some of the different groups that they're a part of, and, help their fellow students. Like being a part of the pre-dental society on your campus, that's a really important thing. And let's see, what else? Hand skills. That's something that may be a little different than medical school, because all dentists have to do surgery, not just the surgeons. And so having some kind of fine detail, hand-eye coordination, very fine motor skill kind of hobby is helpful, and we usually look for that as well. Let's see, what can you add something, Dr. Malone?
Sure, I think you're right. All schools are looking at basically the same thing that Dr. Miller just talked about. Of course, the academics come first because professional school is not easy. It's difficult. And so we want to try to be confident that the student is not going to be struggling while they're in school, that's the first thing. But even though we look at the GPA or DAT scores, but then we look at, we really go into it. In other words, how many hours are they taking? Are they only taking 12 hours a semester? Are they taking 16? Are they working? Are they a student athlete? Are they into big time research, not just a little bit of research, but big time research that takes away from their ability to study? So all these things, so their GPA itself may not be so high, but there's reasons for that because they're doing other things besides simply studying. Mm-hmm. If you just sit there and just do nothing but study, then you can probably make a really pretty good grade. But if that's all you're doing, that's not good enough. So just a pure GPA score is not good enough if you're not doing anything else. And so we also look at leadership. That's also very important. Dentistry is a very one-on-one type of profession. So we look at one-on-one type of community service. For instance, in nursing homes, disadvantaged kids, as opposed to a fundraising for a 5K. That's just one example. Something that you're really working one-on-one with people. And so that's the things that we're looking for in a packet, as well as a lot of dental interests, as Dr. Miller said, being part of a pre-dent society, and also doing things within that pre-dent society, because we see a number of applications that say, I was part of the pre-dental society, but we look at their community service and there's nothing there. They were just simply part of the pre-dent society. They might have gone to a couple of meetings, but they didn't take that organization and use it to their advantage to do a lot more shadowing or community service or things that come with being part of that organization. And they're lucky to be in the organization because some schools don't have a pre-dent society. And if that school does not have a pre-dent society, starting one up is also something we really look at. Someone like, wow, that person's developed that and wasn't there before. That's pretty impressive. So again, things that we're looking for in terms of the application.
Thank you so much for that. I do have a follow-up question, as I usually do. With regards to, I believe it's called manual dexterity, Dr. Miller, you brought that up. How can somebody show that in their application?
Oh, different kinds of hobbies. It doesn't have to be dental related, but any kind of hand skill hobbies. And there's a whole variety of that. And, maybe it's fixing cell phones or putting together computers or doing needlework or sewing or painting, playing musical instruments. Seems to have a high correlation of manual dexterity and some people make jewelry and, just some people who like to fish do make their own flies, so anything just very fine motor skill, small detail kind of things. Just it depends on, whatever the applicant likes. Don't pick one of these things just because I've mentioned it in a long list of things, unless you want to do it, you won't do it. So it's like having a hobby that you really love to do, knitting or crocheting or something like that. Excuse me. And so like the more you love it, the more you're going to do it. And then what we found is anything like that is going to transfer those skills to when you're actually working in like in the preclinical lab where you're practicing on mannequins. They do that first, and then that will transfer to the clinic when you're working with a patient. Yeah, did that kind of answer your question a little bit?
Yep.
Absolutely.
And I can segue with Dr. Miller. Just fine motor skills, like fine painting. Some people can do that. Whenever they say, "Well, paint," not like you're a house painter or you're a very fine motor skills. Models, building models in which you have to take small pieces and very delicately place them in locations in which you're using finger rests. In other words, you're using your other fingers to help support what you're doing with your thumb and index finger. And that's what dentistry is all about, where you hold up a handpiece, but your other fingers are there for rests and so forth. So they're very important. So all your fingers are important in terms of your hand skills. So we look at things of that nature where you're using all your fingers. So very, very fine motor skills, or even an instrument in which you're just barely moving your fingers and making the action.
Thank you for sharing those examples. We do have a few questions that have come up in our live feed here. We are here to answer any of your questions. We have about just over 15 minutes left in this session. So I do want to make sure that we address these questions. The first one has to do with the secondary applications. Dr. Miller, I believe you're the only dental school that has a secondary application. What does the timeline look like for secondaries this year?
Well, our secondary application is already open, and our secondary application is mainly to get the applicant's information into our system so that we're able to download their TMDSAS file to our system. So there's no fee for that. And so it's not a long application. It's just the main vital information from the applicant to be able to get into our system. So we call it a secondary application, but it's not anything like the TMDSAS as far as length and so all of that.
Yeah. You all don't have additional 20 essays to fill out.
No, but this year we did put a COVID-19 coronavirus optional essay. So that's on our secondary application. And I believe our Texas A&M Medical School is doing the same thing. And so it's optional. That's for the applicants to let us know how the coronavirus might have affected their spring semester or, DATs or application or family life or whatever. They can tell us whatever they want to about that.
Maybe that will also show how inventive they are.
Yeah.
All right, so another question that we have in here. Do you anticipate any changes for the interview process for dental schools, especially if coronavirus returns or stays through the fall?
You want to start, Dr. Malone?
For San Antonio, because it's virtual, normally we have two interviews, one with a faculty member and one with a student. I think because it's going to be virtual this year, we're probably going to combine that interview with the instructor and the student at the same time talking to the applicant. In other words, they'll ask them questions. It won't be normally it's a 30-minute interview, but they're not going to be there an hour, so it's not going to be an hour interview. But we're going to have both the professor and the student as part of that interview. So also we're probably going to have a virtual introduction to the school, a virtual tour in the morning time. Unfortunately, we won't be able to do a physical tour of the location, but we'll have videos on that, and we'll talk about it in real time. I've prepared a PowerPoint, and we'll go through that virtually. And I'm also going to prepare it as a MP4, just in case something happens. I can just have individuals take a look at it if I'm not available, and then we'll have the interviews. But just one interview with the instructor and the student. And then later on in the cycle, try to, when everything is hopefully gone down in terms of COVID, to invite all those who've had interviews to physically come to the location so we can give them a physical tour and have them talk to students and things of that nature.
Yeah, and we're planning, all of this is still in the development stage, but we're planning to do virtual interviews, and it'll be, we're going to try to have them as much as they used to be as possible. At our school, each interviewee would talk to 2 faculty members for a short time, about 15 minutes, and about the same amount of time with me. So that was like 3 members of our admissions committee. And so our plan is to do something similar. They'll probably be asynchronous though. So what that would mean is they're not going to be all at the same time on the same day. And so I'm just kind of thinking out loud because we really haven't finalized any of this, but like within a particular week, for those who were invited for an interview, they might be contacted by me and then 2 other members of the admissions committee. You know, when can you get together during these 3 days for about 15 or 20 minutes? And so those would be the interviews. Also, kind of a similar thing with a student. One of our D4 students would contact them, and they'd get a chance to talk with dental students that way. We will also have a virtual tour. We're working on that right now, putting that together. And so there would be videos that the applicant would look at before the actual interviews. And like Dr. Malone said, we're hoping that sometime later in the application cycle, we'll be able to invite all of the people who had an interview to come to the campus for a tour and open house kind of thing. Hopefully that would be available. Yeah, so it's going to be totally different, but we're going to try to make it as similar as possible virtually. Yeah.
Thank you. And I think a key takeaway here is that, virtual interviews are definitely a contingency plan that is being explored by all of our schools right now. But unfortunately, as with many of the updates regarding this pandemic, it's almost a day-to-day basis still. And we just have to build these plans. Certainly, you probably even have a hybrid plan ready to go, or a plan to go in case, some magic way everything goes back to normal.
I think that because, and, you know, this is just our first draft. So this isn't set in concrete yet because we're still planning on it.
Right.
But once the decision is made, which way to go, we have to go with that decision. We can't go virtual and then go back, and because that's not fair to have it that way. So it has to go virtual. And I think Dr. Miller brought up a really interesting point where when we were getting together the schools was that even if the COVID has gone down, if someone develops the flu, say, with a temperature and so forth, we don't know, is that flu or is that COVID? Do we have to reappoint them, reschedule them once they get in, a physical, having to physically come? And so that's going to create a big problem in terms of having to reappoint individuals because of a flu rather than a COVID. And so we just said, you know what, we don't want to go virtual, but it seems like we're just going to have to go virtual because otherwise it's going to be chaos with the physical interviews.
Right.
Right.
Yeah, there's so many contingencies, so many variables up in the air. Okay, we have another question. We are about 10 minutes away, so we may have to do a few rapid fire because I could still see about 5 questions left. So this one is from one of our folks that are watching right now. I included a service activity of playing bass guitar in my worship team at my church, but my pre-dental advisor recommended that I list it as an extracurricular. I'm sure this distinction will not make or break my application, but what are your feelings on this distinction? And this is actually a huge point of anxiety and stress for so many of our applicants, as we hear a lot of phone calls coming into TMDSAS are about, there are 12 categories under which I can put my activities. Which one is it, and is that going to make or break me? So we're interested to hear your thoughts on that.
Well, we read all of it. So, so we're going to see. So where did they put it instead of?
They were putting it under extracurricular.
They ended up putting it in extracurricular. Yeah, that's fine. And, a lot of the kind of hand skill stuff ends up in the extracurriculars, leisure activities, or is that what you call them? Extracurricular?
Yes, activities.
Yeah. Okay, yeah. So we read all of that. So I do sometimes people put them in many different categories, and I keep saying, oh, that's the same thing, But anyway, it probably doesn't matter too much. The things that are really dental related go under healthcare.
I agree. I think it's not like you get bonus points for community service. That's worth more if you put it there than it's someplace else. So we look at it. We look at it all. And so if you explain what you're doing it for, some people just enjoy playing an instrument just for the hobby of it. Some people are doing it as a more of a community service link, I guess, doing it for the church. The important thing is that you describe what that activity is so we get more knowledge of that. And also, as Dr. Miller, don't put it all over the place. Put it in one location so we can look. We don't like that, actually, be quite honest, to see the same thing over and over again. Just put it in one place. We get the information. We'll be able to utilize it.
Yeah, we get that question so many times, both at the TMDSAS office and in our online communities. Sometimes we have folks who maybe do Habitat for Humanity over the summer, and they've been doing it for 10 plus years, but they also don't want to put that they're involved in it for over 10 years since it's only that one time period. So, I challenge them to, they might enter it multiple times, but each time was different. So I challenge them to really explore what they've taken away from it. Maybe their role may have changed. But yeah, we definitely don't want them to submit the same thing in multiple sections. That is very clearly against everything that's in the TMDSAS application handbook and clearly the directive of our schools. Okay. Just wanted to send a shout out to Dr. Beck. She is so incredibly helpful while I was applying to the schools. I'm headed to medical school in August thanks to her. Take notes and listen to these guys, folks. And that's from Kensley Grant, Dr. Beck.
Thanks.
Hey.
Thanks, Kinsley. It's great to hear from you. Good luck.
All right, we have another question. Financially, are some of the fees waived or reduced for applications? I can take this one for TMDSAS. The TMDSAS application is a flat rate fee of $185, and that's whether you apply to one dental school or all four. We do have a new dental school. Tomorrow we will be speaking with the Woody L. Hunt School of Dental Medicine in El Paso, part of the Texas Tech University Health Sciences Center system. So join us tomorrow at 1 for a conversation with them. If you're a medical applicant applying to one school or all 12 medical schools, it's the same $185 flat fee. And for dental applicants, if you're applying to one school or both veterinary schools, as we have planned for this next application cycle, it's that same flat fee. We do not have any fee assistance programs as part of TMDSAS, unfortunately, but we do work really hard to keep our costs low for our applicants. And this is actually a really great value compared to other application services. As far as the secondary applications go, we just heard from Dr. Miller that the secondary application is free for dental applicants. For medical schools, if you did receive a fee assistance program waiver from the AAMC to take the MCAT, you can reach out to the schools individually to see if they might offer any reduced fees for their secondary applications as well. But those fees are also, when they are applicable, they are relatively low compared to the national average as well. Okay, I wanted to ask, should I submit my ADSAS application before I take my DAT? I am not entirely sure if ADSAS will allow you to submit your application before having a DAT score. I would suggest you reach out to the ADSAS to find out what the regulations are. For TMDSAS, it's perfectly acceptable for you to submit your application, even if we don't yet have your DAT scores, your letters of evaluation. And don't forget that starting this year, your transcripts will not be submitted to TMDSAS until they are requested later in the cycle. So hold on to those until then.
And let me jump in here. Ask
Yes,
your
please.
advisor. Get help from your advisor.
Yes, absolutely. All right. We have a couple of minutes left. I'm grouping a few of these questions here, and these have to do more with the dental profession. And we do have just a couple of minutes left, so I'm just curious, some of the impacts of COVID-19 this year have really been focused on the business side of healthcare, particularly with a lot of dentists who may have had to close their offices due to the COVID situation. And so do you all have any feedback on takeaways that an aspiring dentist might look toward seeing in a world like this? I know dentistry tends to be a lot more business-sided or business-minded. You do have some additional considerations. So we're curious to know if there are any considerations or highlights that aspiring dentists might focus on right now.
Well, dentistry is an essential health care. You're essential health care provider. I think the coronavirus has impacted a lot of dentists, unfortunately, because of the nature of the profession. Just the nature of doing a preparation operative on an individual. You have a lot of air spray, you have a lot of contact with vapors in the air. It's almost as if you're someone who's going to be intubating someone. So you're at the very highest level in terms of contracting the virus, more so than many physicians. And so therefore, that was why the dental profession really had to take a step back in terms of this virus. And they're just now trying to get back because of the fact that it is such a profession in which you're going to have this type of very closeness, close to the patient. You have this water air going in the environment, very difficult to control that. And so that's why it was only emergency type work where you have to have a negative vac to try to get things to minimize. It really should have been done in a hospital setting. And so now as we go back, dentists are facing that. And this is something that they've never, ever had to face before. So it's not something like, oh my goodness, we do this all the time. And hopefully it's not something that's going to be occurring again, but that's not to say it's not going to. So dentists as a profession are going to have to really evaluate when things are all said and done, how another incident like this is going to affect their profession. So this is something that's long-term in terms of the ADA, in terms of even credentialing, in terms of getting licensure from dental schools. That I'm sure you imagine I'm sure Dallas is with that same issue in terms of individuals graduating on time and so forth. So it's just tough. I wish I could talk about it longer, but I'm just running out of time.
Yeah.
It's a larger issue, but I appreciate the insights. Okay, well, there's one more question that popped up, and I do want to address it real quick. Can sports such as volleyball and basketball be included for manual dexterity? So we don't have a manual dexterity section on the TMDSAS application, so you would include that under leisure. Critically thinking, I've never been able to fit a volleyball in my mouth, and so I'd imagine that in terms of manual dexterity, that might not be a good option. But it's excellent to include that in your application. Those are some great experiences that you should share. But based off of the feedback that Drs. Malone and Dr. Miller shared right now, we're looking for finer work.
Well, that's still something, Enrique, that we look at. That's teamwork. That's and you're going to lose. You're not going to win every time. How do you accept that defeat? Things like that. So again, that's something we're looking at.
Yeah.
Yeah.
And it's important in the application. So before we let you two go, this is a courage session. So we wanted to ask if you had any encouraging words for our applicants, maybe this cycle or even future cycles.
Don't lose sight of the goal. If that's what you want to do, go for it. And all the schools realize what's going on. It's not like we're trying to give you a hard time. We know what's going on. We know it's going to be difficult, and the schools have accommodated for this. We know that there are going to be difficulties. We know that that is still an issue. And that's something that's not approved by me. That's probably not approved by Dr. Miller. That's really at the dean's level in terms of whether we accept DAT scores and so forth. And so at this time, we are accepting them, but we try to accommodate, in terms of the interview process. So, and we also know if you're applying next year, we know there's going to be a gap there. We've accepted that gap. We know it's going to be there. Don't worry about it because everyone else is going to be in that same situation. And you're competing against people within that cycle.
Right. Yeah. I ditto on what Dr. Malone said. Yeah. Just, keep thinking of your goals, your long-term goals, and just keep working and, do your best. And you're, like you said, you're applying in this cycle with everybody else under the similar conditions. Not everybody's got exactly the same conditions, and we realize that. So that's why we want you to tell us about your conditions. But anyway, just we're making adjustments, and this is a day-to-day. Things are changing every day, it seems like. So this is a good test for all of us of patience and resiliency. Even for us oldies, this is a test for all of us. And so Yeah, I'm looking forward to seeing the applications as always. I'm looking forward to meeting everybody virtually and eventually in person.
Excellent. Well, again, thank you both so much for all of these excellent insights, and we'll be keeping a recording of this on our Facebook page at TXHES on Facebook. And Dr. Beck, as always, it's a pleasure to co-host these with you. Thank you so much for your feedback, and we will be back tomorrow with the Texas Tech University Health Sciences Center Woody L. Hunt School of Dental Medicine. Say that 3 times in a row. And we're excited to see you all tomorrow at 1 o'clock. Thank you.
Thank you. Yeah, thank you.
Thanks.